Hello, welcome to Cal State LA. So excited to have you here at the beginning of your journey into healthcare. Part of what I want to do is to talk about some of the myths or reality checks that you need to realize about being a nurse before you get into the profession. Oftentimes when people get into nursing, they get into nursing because they want to help people or they like to see themselves as a hero. And this is great, and this is absolutely an all right motivation to get into nursing. But the challenge is the reality of the work is oftentimes different than what we see on television or what we may think it is in our mind. So there's two big things I want to talk to you about as far as nursing is concerned. The first is the reality that nursing is a customer service oriented field. Yes, absolutely, there is a lot of hard work, scientific background that goes into nursing, but a lot of it is engaging with people day to day. And so one of the big things that people don't recognize when they get in nursing school is how much you need to be comfortable interacting, engaging, talking with, and helping people or your patients. So one of the big things that is important to understand is that everything that happens in the hospital technically falls under the nurse's scope of practice. So that while there is CNAs and nursing assistants that can help you with some of the tasks that you're doing, it's your responsibility to get those done. And while you're delegating them, you also need to know how to do them yourself. So part of what nursing school is learning how to move people, how to wipe people, how to talk to people, how to make sure that people get what they need. The challenging thing about being a nurse is the environment that we do all of this in is not necessarily an environment that people are happy to be in, which means that a lot of times the patients that you're dealing with may not be overjoyed or excited to see you, and they may not always thank you after you're done. That's okay, but part of what you do need to develop as a nursing student is an understanding that this is part of the job, and being able to show up, work hard every day, and be part of a team is a big part of what you're doing. The other big reality check that it's important for nursing students to recognize is that you are an independent practitioner. In a lot of media and film, nurses are portrayed as taking orders from doctors or having a doctor come in and tell the nurse what to do. This is simply not the case in the hospital. Nurses may be engaged with doctors for 10 to 15 minutes per shift, but for the most part, you are making your own decisions and your own choices. Part of being a nurse is being confident to make sure that you decide what care a patient does and doesn't need. A big reality check that students have is that they feel like someone is going to come in and tell them what to do, or someone is going to come in and save them when something goes wrong. That's literally the nurse's role, is to identify what's going on, to make a decision about what to do next, and when something is going wrong or abnormal, it's your job to recognize that and communicate that effectively to the rest of the team. Nursing is a wonderful profession. It just may not be exactly what you think it is. And part of what your job is as a nursing student is to recognize and understand the full scope of the nurse's practice and to dispel any myths or take any reality checks you may need about what it actually feels like to provide care in the hospital.